My son was born by cesarean, and about 13 days later I had the stroke. I just lost all feeling, the right side of my body and my ability to talk. And I had had a bad headache on this side of my head for a couple of days, but that night I had taken a shower and got out and laid on the bed for a while.
Her sister lives upstairs, and her fiance had gone up to get her. And sister come down and looked at her, and they decided to call 911. Ambulance very close, got her to the hospital that is also very close. And they checked her out, and they put her in a helicopter right away.
The outside hospital called her to inform that they had this young woman that was having right side paralysis. And at the time we activated different teams, the emergency room, the neurointerventional team, the ICU, and the obstetric and gynecology team.
And I heard about her through our endovascular team. There was a potential acute stroke case, and that it sounded like a patient who would benefit from the services that we offer in the hospital.
We started with something called Nih Stroke Scale, which is a basic neurological evaluation.
I just remember going through halls and being in a stretcher and having stuff done. I don't remember a lot.
We have one medication we can give through the vein, an intravenous clot buster medication called TPA. We have 4.5 hours since the last time the patient was completely normal. Past that 4.5 hours, we consider that we have at most up to 8 hours for a certain type of strokes and up to 24 hours for other types of strokes, which is not what Laurie had.
Here at MGH, we have, over the past year, created an early activation protocol to make sure that once a patient arrives to the emergency room, all of our teams, the anesthesia team, the neuroendovascular team, the acute stroke staff in tandem are working together to make sure that everyone is ready and set up.
The blood vessel on the left side of Laurie's neck had torn. It's a process called a dissection. It allows the inner lining to be lifted off the wall of the blood vessel like a flap. And that flap is like a sail that blocks flow through the rest of the artery. But it also generates clot because it's an injury to the blood vessel lining, and the blood reacts to that injury. And then that clot can travel up and stick higher up in the brain. From a treatment standpoint, that's pretty challenging because you have to open the neck to open the head. That's your route to the blood vessel in the head.
And by the time we got there, we went from one waiting room to a couple others, and they were talking us through, and Dr. Mazwi came down and explained what happened and what the outcome should be.
We did a neurological assessment immediately after the procedure, and she regained immediate movement of the right side of the body, the arm and leg, as well as her speech functions.
It was like a miracle every time we went into the room to see her. She was doing something she couldn't do before.
I'm going to use the word amazing. By the day that she left the hospital, which is only 3 days after she walked into MGH, she was completely fluent. A couple of weeks after, she did not have any trouble that she could really notice.
To see her with Jack now, and to think about all the years she has ahead of her that will be normal years, it couldn't be more gratifying, and it makes all the work that we put into the things we do here feel worth it.
The short time interval from door to recanalization of the blockage, that is actually one of the main factors that contributed to a successful outcome in her situation.
Yeah, I feel good. I feel normal like I did before.
Her case teaches us how we can still care for this young population in very uncommon and difficult presentations if we do it in a multidisciplinary way.